Buenos días a todos y gracias por acompañarnos hoy. Mi nombre es Alejandra Cabrera y soy la directora ejecutiva de Sustentabilidad para México, SUME. Estamos muy contentos de darles la bienvenida a nuestro segundo evento de este año de Lead Innovators, titulado Creando Lugares Sustentables para Todos. Quiero destacar la importante cooperación que hemos venido desarrollando entre el GBCI México y SUME. Empezamos con estas actividades de manera muy exitosa el año pasado y continuaremos poniendo a su disposición temas interesantes, buscando siempre compartir casos de éxito y mejores prácticas con la finalidad de inspirar a todos por medio de experiencias y ejemplos a todos ustedes que a lo largo de estos eventos nos han acompañado y han continuado empujando a nuestro país y a sus propios países para que siga creciendo la construcción sustentable en toda la región. Rebe, te agradezco nuevamente la confianza que has depositado en SUME para llevar a cabo estos eventos y pues bueno, sin más ni más, les agradezco a todos su asistencia, su puntualidad y le cedo la palabra a Rebeca Ortiz, líder de negocio del GBCI México. Adelante, Rebe.
Muchas gracias, Ale. Te agradezco mucho la oportunidad. Y bueno, quiero agradecerles a todos su asistencia el día de hoy. Muy buenos días. Como ya dijo Ale, yo soy Rebeca Ortiz, líder de desarrollo de negocios del GBCI en México. Y es un placer darles la bienvenida al webinar Lead Innovators, creando lugares saludables para todos. Quiero agradecer a SUME, su mesa directiva, a Ale y Fabi por su apoyo e interés en fortalecer a nuestra comunidad por medio de estos webinars, que sin duda buscan avanzar el trabajo de los profesionales de la sostenibilidad y nuestra organización en México y dar a conocer los beneficios de la práctica de la construcción sostenible a todo aquel que aún no lo practica. El 18 de marzo cumplimos un año en que la mayoría tuvimos que poner pausa en nuestras actividades cotidianas para comenzar un periodo de cuarentena como resultado de la pandemia por el COVID-19. Durante el último año, todos hemos enfrentado los impactos de una crisis mundial de salud pública. Sí me están escuchando, ¿verdad? Sí,
Sí, sí se
perfecto.
escucha.
Muchas gracias. Y estoy segura de que todos hemos pasado mucho más tiempo que nunca pensando en nuestra salud, seguridad y cómo los edificios pueden contribuir tanto a la salud personal como a la salud pública. Por más de un cuarto de siglo, el USGBC ha trabajado en definir las mejores prácticas globales para diseñar, construir y operar edificios y espacios sostenibles a través del LEED. Sin embargo, era hora de visibilizar con más ímpetu todo este trabajo hecho a través de nuestros programas que buscan transformar el entorno construido y la vida de todo aquel que está en contacto con cada uno de nuestros proyectos. Hoy vamos a hablar de las formas en que el LEED aborda la salud a largo plazo, por el bien común de la salud pública y por el bienestar de los ocupantes del edificio. Y a corto plazo, en momentos como ahora, cuando nos centramos en la salud y la seguridad inmediatas de las personas. Si desean aprender más sobre cómo el USGBC se está centrando en la salud humana, los quiero animar a leer sobre nuestra nueva estrategia, Personas sanas en lugares sanos equivalen a una economía sana, que está en la página de México de gbci.org. Durante 2020, como parte de la estrategia del USGBC, se actualizaron en LEED versión 4.1 las estrategias que apoyan la calidad de ambiente interior, limpieza, confort de ocupantes, operaciones, mejores materiales, gestión de riesgos, al tiempo que se encontraron oportunidades para introducir nuevos enfoques ante la actual crisis de salud pública. El día de hoy estoy muy contenta y muy honrada de poder escuchar de la voz de Kelly Warden, directora de investigación de la salud, el trabajo que se ha hecho en relación con la salud y con estos trabajos, cómo se están identificando con estos acontecimientos que seguimos viviendo actualmente. Seguido de la presentación de Kelly y como ejemplo práctico de estas medidas, estamos muy agradecidas con Jorge Martínez de Cushman & Wakefield, que aceptó nuestra invitación para platicar su experiencia con los créditos piloto de la seguridad primero, desarrollados para ayudar en la gestión de los edificios durante la pandemia del COVID-19. Para entrar en materia, quiero presentarles a Kelly. Kelly Warden lidera los esfuerzos de investigación en salud en el USGBC y codirige la iniciativa de investigación y desarrollo de la Alianza Verde para la Salud entre la Facultad de Medicina de Virginia, de Estados Unidos, que se lleva a cabo con el financiamiento de la Fundación Robert Woodward Johnson. La Alianza Verde para la Salud ha desarrollado una variedad de herramientas de promoción de la salud, incluido el proceso integrativo LEAD para el uso de profesionales de la construcción verde y el módulo de salud y bienestar de GRESP para el uso de empresas inmobiliarias e inversionistas. Kelly tiene una maestría en salud pública de la Universidad George Washington y una licenciatura en biología humana de la Universidad de Texas en Austin. Without further ado, Kelly, we want to thank you for accepting our invitation to talk about your work in the advancement of health in the built-in environment. Thank you. The floor is yours.
Thank you, and thank you so much for having me. It's nice to be able to connect with you all in Mexico. I'm based in Texas, so I'm not very far from you all. And I grew up in San Antonio and took many, many years of Spanish. So my parents would be quite disappointed that I'm not presenting to you in Spanish. But maybe one day I'll be able to meet with you in person and we'll be bold enough to try out my Spanish.
Thank you so much.
But yes, I'm really excited to be able to meet with you all, and I'm gonna shape this conversation into 3 different parts. So the first one will be looking at public health economic trends. The second part of the presentation will look at real estate market trends for health, and then finally we'll focus really specifically on health promotion tools that our team has been working on over the past couple of years. So starting out first with public health economic trends. I mean, as we're all been very familiar with over the past year, the COVID-19 pandemic has really been a very extreme demonstration of the connection between public health and the global economy. The pandemic has, of course, caused a lot of uncertainty within global markets. It's also led to the majority of countries in the world experiencing a recession, deeper in certain countries than others. And so we recognize that, well, I'm a public health professional, so I care about public health because I want to afford opportunities for health to everyone. But even if you don't have that moral imperative, there's a clear business imperative to be focusing on efforts to promote population health in a really equitable way, meaning that everyone has access to opportunities for health regardless of your income level. So after kind of reflecting on what we've all experienced over the past year, I wanted to kind of go back to 10 years ago, which was back in 2011, when the World Economic Forum and the World Health Organization convened a high-level meeting at the UN General Assembly focused on non-communicable diseases, or more commonly known as chronic diseases. And there was a series of reports that came out really raising the alarm that chronic disease was on the rise across the world. It was particularly going to become an economic problem within lower and middle income countries that were still experiencing high rates of infectious disease. And basically, they were able to release this report looking to estimate that these diseases were going to cost $7 trillion in lost output over a 15-year time period. Looking at some more updated numbers, this is specific to the US, but it's estimating that these collection of chronic diseases are going to lead to a total economic disease burden of almost $95 trillion from 2015 to 2050. So this is a huge economic crisis, and one that is challenging to address, which we'll get into. So because these group of diseases are quite expensive, they're chronic, which means that once you get them, you have them for a long time. There's a lot of inherent economic value in preventing these diseases in the first place. That leads to economic benefits because you aren't spending as much money on treatment, and also when you are able to prevent people from getting sick, that means that they're more able to participate in the economy. There's also, of course, a number of social benefits that come from preventing disease and simply promoting health at the beginning. The challenge with preventing and controlling these diseases is that it's out of the control of the healthcare system. So these chronic diseases that we're talking about, that's cardiovascular disease, cancer, respiratory disease, mental illness, these diseases are all really influenced by the conditions in which we live. And so the most effective way to prevent these diseases is actually to promote healthy behaviors in the first place. And so the World Health Organization has identified these best investments for preventing and controlling chronic disease. And 4 of the 6 best investments are things that we have influence over within the real estate industry. So things around reducing physical inactivity, reducing unhealthy diet, reducing harmful use of alcohol, and reducing tobacco use. While these behaviors used to be viewed as sort of individual choice, there's increasingly widespread recognition within the public health community that while yes, individuals do have some level of choice, in reality, the construction of our cities, of our neighborhoods, of our buildings has influence over how people, the level of choice that individuals are afforded, and then also we're able to sort of encourage healthy behaviors through the built environment in a more meaningful way as well. This is a kind of complicated framework, but one that I really like to show. So this was created by a group in the Bay Area in San Francisco and California that's really looking to break it down and make it very clear for people that are focused on having control over our living conditions, how they relate to downstream health. So what you're seeing in this figure is that on the right-hand side, you have mortality, which is something we want to avoid. That is preceded by disease and injury, which is also something we'd like to avoid. And your likelihood of getting sick or getting hurt is influenced by these risk behaviors that I was just talking about. But then if you keep going upstream, you'll see that the living conditions section of the figure is quite emphasized, and that is because our living conditions have a good level of influence over the prevalence of those risk behaviors and then downstream health outcomes. And so we as green building practitioners have direct influence over the physical environment. To some extent, we have influence over the social environment. We're able to shape places in a way that encourages social cohesion and interaction. We as an industry have influence over increasing access to work opportunities and employment. So we're able to have positive influence in a number of different ways. So recognizing the importance that place has on health, that has led me and many others within the public health sector to start to ask, well, how can we then go about promoting, creating health promoting places for everyone, everywhere? What's shown in the background of this slide is an abstract version of a series of maps that were created for cities across the US a few years ago that showed really stark differences in life expectancy just within a few different miles. So this is actually looking along subway lines in New York City. There can be differences in life expectancy of up to 10 years just based off of where you live in the city. And so we have really been focused on, okay, well then what can we do now that we understand that place has a real influence over health? What can we do to actually promote health and create healthy places for everyone? This is where our group has been focused on really learning from the green building movement and viewing it as more of a template for influencing decision-making within real estate. So I've been very fortunate to work at USGBC for over 8 years, and I've been able to learn quite a bit in that amount of time. As a public health professional, they teach us about how we understand the association between things like neighborhood and health, but they don't teach us very much about how to actually influence the way the neighborhoods are created. And so I've been able to learn a lot from my colleagues at the U.S. Green Building Council and working with folks like you. We have really taken an approach to understanding green building as more of a blueprint for transforming the real estate market. And so we refer to this initiative as the Green Health Partnership, and it is a partnership between the U.S. Green Building Council and the UVA School of Medicine. We've been able to receive funding from the Robert Wood Johnson Foundation, which is the biggest public health philanthropy in the U.S., to really help us, first understand what green building teaches us about influencing real estate, and then we actually went on to create some health promotion tools. And so our work has been split on 2 different scales. One is working with traditional USGBC tools like LEAD to create health promotion tools for built environment project teams that are working on individual buildings. And the other was partnership with GRES to create a similar set of tools, but for use at the real estate portfolio scale, and to begin to understand at the high level, what are institutional investors valuing, and how do we start to position health as something that investors could intentionally direct dollars towards? So I'm going to first use some of our work with GRESB to talk about broader market trends for health. And we've actually been at a very exciting point within the real estate industry, because pretty organically the industry has started to become interested in health over the past 5 to 8 years. So this is even looking before COVID, and now COVID is of course going to be an accelerant for those sorts of interests and trends. So what we've seen through our work with GRESB is that, and so when we're working with GRESB, we're really interfacing not only with the investor, but also real estate companies and fund managers. And we've seen that health has been increasing as an emerging area of focus. It's seen as an opportunity to manage new sorts of risks, to create new sorts of value, and it's also just a new opportunity to demonstrate leadership and competitive differentiation, similar to how green was viewed when it first entered the market decades ago. We were able to work with GRESB to create a health and well-being module, which ran for 3 years. And so that's really the only takeaway from this slide, is that some of the figures I'm about to show you are from 2016 to 2018. So again, a few years before the COVID pandemic. This module was created in two folds. It had both an internal focus, which is analyzing how real estate companies address and promote the health of their own employees, and then also an external focus. So that's more of the market-oriented focus, looking at how real estate companies address and promote health for the tenants and users of their real estate that they design, construct, and operate. What we saw is that even back in 2016, when this module first launched as a voluntary add-on assessment, there was already a high level of interest in participating. There were 174 real estate funds that participated in the first year of the module. This increased to 252 funds in 2017 and 297 in 2018. And after the 3 years of this module being run as a standalone separate assessment, we actually worked to integrate it into the main GRESB real estate assessment, which, for those of you who are familiar with the GRESB real estate assessment, over 1,000 real estate funds participate in that annually. And so actually right now we're working to analyze data collected by the assessment last year, and we're going to be releasing another report soon that'll have some updated figures on where the industry is with health. The other thing that was really encouraging for us from a public health research perspective is that we were able to see performance increase pretty rapidly from 2016 to 2018. What we've learned with GRESB is actually similar to what you'll hear me talk about on the lead side, and that is that simply having established processes and frameworks that allow companies or real estate teams to apply to their existing work is really just the first initial step in improving performance. And so it's quite encouraging to see that just that first initial step of self-assessment allows you to actually begin to take action to improve performance in a pretty rapid way. One thing that's also been interesting to explore is this is looking at specific design and operation strategies that real estate companies are taking to promote tenant and customer health and well-being. And we're looking at the majority of participants versus the leaders, those that scored the highest. And you'll see there's quite a difference in approach. I mean, not surprisingly, leaders are just doing more things. But then there's also certain issues that as a public health practitioner, I would have thought were already pretty well established. Things like even water quality, ergonomic design, inclusive design, that were still not very widespread within that leader group either. So we definitely still have room to improve. So that top line takeaways from our experience with GRESB and what it tells us about trends for health within the real estate industry is that companies are beginning to include health and well-being as really explicit components of their ESG, their environmental social governance strategy. I'm not sure, I don't have my fingers on the pulse of the conversation in Mexico, but I know within the US there's lots of speculation that with the Biden administration, there is going to be more intentional focus on ESG. There's going to be more of an expectation that companies have a robust ESG strategy, and not only because of everything we've experienced with COVID, but also because of the recent increased focus on social justice issues and rise of the Black Lives Matter movement, and companies recognizing that they have they need to have something to say in terms of how they relate to these issues. And obviously, of course, climate change continuing to be such a pressing concern. So as ESG is on the rise, we hope that health and well-being will solidify themselves as really explicit components of environmental, social, and governance issues and efforts. We're seeing that that leading real estate companies and funds are also empowering a senior decision maker to be held accountable for health, which helps you actually take action. And then on the action side, companies are thinking about different population scales, so not just their employees, not just their immediate tenants, but also communities around the buildings that they manage, and thinking through things like how their decisions when it comes to things like procurement have influence over health of those populations impacted by the supply chain. And all of this is really guided by an intentional health promotion process, which we're going to get into in a more detailed way in the next section. So looking at tools for health, this is where we're going to focus. I'm going to tell you all about the work that we've been doing down at the individual building scale. So just as a starting point, we are operating within the long history of the green building movement, which has really established itself as a global movement dedicated to creating better places for people and the environment. Within green building, so my colleague Chris Pike, who's now head of product for ARC Skoru, but was VP of research for U.S. Green Building Council for a long time, he's been very articulate in identifying that if you look back on the green building movement, we've actually had different eras of health promotion. So it started off really focused on environmental health. I mean, within the initial, if you just take LEED as a proxy for green building more generally, the initial rating system included things like asbestos control, tobacco control. We wanted to make sure that we were at least not introducing toxins into the environment. There's also been an era very focused on global health, which is the green building industry's ability to mitigate climate change in a way that protects and promotes the health of future populations and increases the likelihood we will have access to the resources that we need to live when it comes to things like water and clean air. More recently, again, even before the COVID pandemic, there was more of an increased focus on occupant health and well-being. This definitely has been in part driven by the rise of things like the WELL building standard and FitWell standard. And so moving forward, what our team is really advocating for is that there's more of a focus on having an intentional approach to health that allows teams to think about all these different versions of health, all these different levels of health impact, and take a more tailored approach that makes the most sense for the project and the context that they're working within. So just looking at what we already have within the LEED rating system, I think it's important to remember that the LEED V4 system goals do include a number of things that are very relevant to health. Human health is an explicit system goal, and then also, of course, water resource matter for us. Community quality of life is very relevant. And then there's also a very intentional weighting that has gone into how different strategies are given different levels of credit within the system. And that is primarily focused on climate change as a primary, climate change mitigation as a primary goal. So the way this manifests within the actual rating system, our team did what we refer to offhandedly as a health scan of LEED. We did this for LEED 2009, and then we've also done it for LEED V4. Where we basically go through and take a public health lens and say where within the rating system are there existing health-related strategies, and how easy would it be for a team to use those strategies in their current state. So these images are from a paper that was published last year that is free to access and download, which basically categorizes available health-related credits within LEED V4 based off of the population scale that they have influence. So we're looking at the site user, the surrounding community, the supply chain and waste stream, and the global population. The other thing that's being shown within this image is we've categorized these based off of how easy they are for an average practitioner to recognize as health related and then also implement. And so these credits that we refer to as having stated health impact are the ones that, that identify themselves as health related. And so if you look, for instance, just within the global scale here, that's 25% of the existing credits within LEED V4, B, D, and C with relevance to global health really call themselves out as having that global health relevance. Then there's another 25% or so that are understated, which means that the health benefit is there, but it's not necessarily that clearly articulated as such. So if you are a practitioner going in to looking at the rating system, wanting to select health strategies, some of those are not always so easy to find. And then there's a portion of credits that we refer to as pathway dependent, which means that there's a couple different compliance pathways to achieve that credit. Some of those might have health benefits, some of them might not. And we found that within thinking about surrounding community health, there are a number of those such strategies within the system. So again, you'd need to be taking an intentional approach to really get the full health benefit of those already existing credits. The other thing that I find interesting is that opportunities for health promotion, particularly when you're taking this population health approach, are found throughout the rating system. So I think while it's very common for people to think of the indoor environmental quality section of LEED as the most health relevant, there are actually important and health-oriented strategies present throughout the rating system. And finally, one of the interesting things we did was then compare, okay, looking at the credit points available for those health-related credits and how that stacks up to different certification levels. And so you can prioritize health while also scoring well within your LEED scorecard if that is something that you're motivated by when it comes to the different levels of certification. Something else that we looked at were just the language used for to refer to health within LEED, and it is there are a lot of different health-related terminologies used. One of our takeaways from this is that health is a long-standing value of green building, and it's definitely been there from the beginning, but it hasn't always been the primary intention. And therefore, as we talked about with those different eras of health promotion, different types of health have been focused on throughout the years, and that leads to kind of a smorgasbord of different health topics being represented. And one key takeaway of this work is, again, one of our colleague Chris Pike's lines is basically making sure that we don't allow the market to go about doing random acts of health promotion. And in a way to avoid doing random acts of health promotion is actually to take a more intentional, process-oriented approach. So our team is really focused on processes as predictors of future performance. And back a few years ago now, we partnered with a couple of different organizations in the US to create this LEED health process, which is really inspired by health impact assessment. Health impact assessment is a longstanding public health framework that is intended to guide decisions within non-health sectors to have more of a positive population health impact. So we created this LEED health process, and while I'll show you the versions of it that are currently within the rating system, some of them can look quite complicated when you look at the language, but really it just boils down to these 4 overarching high-level steps. The first one is engaging community and public health expertise. The second one is using that engagement to understand population health needs and opportunities. The third step is to prioritize action according to those needs, and the fourth step is to evaluate impact. So this process is intended to be used within the context of an individual building project. And while this version of it is available within LEED, we worked with Enterprise Community Partners here in the US, which has a green rating system for affordable housing. There's a version of it within the Enterprise tool here. There's also a version of it available within Green Building Council of Australia's Green Star program. And the process itself is high level enough that I think it could be used and add value to any different type of project, whether or not you were pursuing LEED certification specifically. So this process is available as a pilot credit within the LEED v4 pilot credit library. There's also aspects of it that have made it into LEED v4.1. In the new integrative process credit within 4.1, there are a few different themes that you could focus on within the exemplary performance one, and health and well-being is one of those themes. So I'm just going to go through like a high-level overview of what this looks like within different projects. So the first step of engaging stakeholders This picture is from a medical office building in Virginia in the Mid-Atlantic US region. And what was really interesting, what's been really fun is since the client here was a healthcare organization, they had existing health expertise on staff that wasn't always brought into the facilities conversation. So this picture is from one of their early health goal setting workshops, where basically they had the design team work not only with the facilities team of this medical office, but also bring in their community health person and bring in their person was more focused on sort of the clinical operations to have a broader discussion about who are the populations impacted by this particular project, what are their health needs, and how might that relate to what the decisions we're making when it comes to the design, construction, and operation of this medical office. So the second step is to really set these health goals. This is a picture from a housing development within the San Francisco Bay Area, where they leveraged existing community engagement efforts that are oftentimes required by their local affordable housing financing programs. They leveraged those engagement with the community that was already planned to just bring in a health lens and start asking people about their health experiences and about what they valued, to start to set explicit health goals. So a couple of the ones that I can see here within this picture are things like protected open space for residents or safe streets for pedestrians and cars. So things that had kind of clear relevance to the actual building design project. The third step is focused on taking and prioritizing action. And so this step really means basically looking at if you are working within the LEED certification system, or in this case, this project in Colorado actually pursued both WELL and LEED certifications, but they did it in a way where they were very intentional about choosing which strategies from LEED they were going to pursue, which strategies from WELL they were going to pursue, and how those would work together to help the project meet its explicit health goals. And so this could just look like looking through the strategies that you have at hand and choosing which ones work best for your particular project. And then the fourth step of this process is focused on monitoring impact. But since the process is really rooted within the design and construction rating system, so you wouldn't actually be monitoring impact at that stage. Rather, this step of the process is intended to drive a conversation between the building owner and the project team that would equip the owner to have a more thoughtful approach to monitoring down the line that was really rooted in specific decisions that the design team made around particular design strategies. So the point of this step is really just to drive that conversation about what decisions did we make about this building's design, and what health goals were we trying to achieve with those decisions, and how might the owner actually monitor the success of those design strategies in meeting those goals down the line. I'm going to really quickly just go through another example of what we've been doing more recently, which is we've been engaging with the DC public schools system to apply this process at the portfolio scale. What's interesting here is that DCPS already had a LEED Gold mandate, meaning every project going under modernization was required to meet at least LEED Gold. And so our colleague at DCPS decided to position this LEED health process as a requirement within meeting that mandate. So every time that they go for LEED Gold, they do it using this health process. Applying this at the portfolio level has been really interesting because it's been more of an owner-led initiative that allows them to be more intentional at the beginning of any given project. And they've also been able to apply it to a number of different schools. So the first round of schools that went through was 4 different schools, a few elementary schools, a high school, located all over all different parts of DC, which DC is a very diverse city with very differing health needs and opportunities depending on where you are in the city. They've also been able to go through a second round of schools that brought on another 5. And again, similar to kind of the medical office example that I gave, the school setting is really interesting because you have existing health expertise on staff at the school setting as well. Those experts are just not always brought into the facilities conversation. So this engaging health expertise really meant bringing together a really diverse internal group at DCPS that included food and nutrition, included physical activity, physical education, and health services, and brought them together with the facilities team at DCPS to start to establish those health goals. We've also created a set of worksheets that we're actually going to make available pretty soon that helps guide teams through this initial conversation. It can sometimes be difficult when you're bringing together people from different perspectives and practitioners from different sectors. It can be challenging to get that conversation started. So we've created some worksheets that sort of guide that conversation in what we found to be a more of a meaningful way. The second step of establishing health goals, this is actually a screenshot from a session that they held during COVID. So it was virtual using an online platform to have a conversation about what are the most pressing priorities and health goals for the school facility. And then again, how might design support those priorities that you've identified. We have another worksheet here that we're going to be releasing soon, which helps drive a conversation between software approaches to health, which are more traditional health programs, and then hardware approaches to health, which would be actually things related to the facility. And just simply having that distinction, we found helps bring together, again, those health facility or those health stakeholders and more of the facility-oriented stakeholders. And then again, the step of evaluating impact, which when you are taking in a portfolio application of the process, this part is a lot more streamlined because it is the owner who's actually thinking about this and more planning for future monitoring, which they will actually be equipped to go about doing, whereas a designer may or may not be part of that monitoring process. So that concludes my portion. I'm really, again, excited to be able to engage with you all. Feel free, obviously we'll have a question and answer part here, but feel free to email me, or I've put also our project website. So some of these things are available from the USGBC site, but they can be kind of hard to find. So we have this project website that organizes everything in a more streamlined way. But I look forward to the discussion.
Thank you so much, Kelly. This has been amazing. I'm gonna turn now to to Jorge, that he's gonna be talking a little bit more of all this process that you have been going through. Y bueno, como parte de la estrategia de economía saludable, el USGBC también desarrolló 7 créditos piloto de LEED para ayudar a los equipos de construcción a proporcionar espacios saludables y para ayudar con el reingreso de los edificios. Estos créditos piloto describen las mejores prácticas sostenibles que se ajustan a las directrices de salud pública y la industria relacionadas con la limpieza y la desinfección, la reocupación del lugar de trabajo, el recomisionamiento de los sistemas de agua, el manejo de la calidad del aire interior, la gestión y la planeación de la pandemia y la equidad social en la planeación de la pandemia. Estos créditos, como ustedes ya saben, pueden ser utilizados por los proyectos LEED que están certificados o en proceso de certificación. Quiero dar las gracias a Jorge Martínez de Cushman & Wakefield por su tiempo y generosidad en compartir su experiencia con estas herramientas. Jorge Martínez es arquitecto egresado de la Universidad Intercontinental, cuenta con las acreditaciones LEED AP, Building Design and Construction, es Fitwel Ambassador, ha participado en más de 30 proyectos LEED, WELL, Fitwel y hace análisis de emisiones de CO2. Actualmente se desempeña como Sustainability Manager en Cushman & Wakefield, México, participando activamente en proyectos de sustentabilidad y bienestar del ocupante. Jorge, muchas gracias por acompañarnos el día de hoy. Tienes la palabra. Quiero recordarles también que pueden usar la función de chat para ir haciendo sus preguntas. Al final, Fabi nos ayudará.
Gracias. Buenos días a todos. Solo denme un segundo porque no estoy logrando ponerlo en modo presentación. Denme un segundito.
No te preocupes. Otro tema que también les quiero comentar, también Fabi nos va a ayudar con eso. Esta presentación les da hours, entonces Fabi nos va a hacer favor de poner el número de curso.
Listo, ahora sí.
Se ve perfecto,
Gracias.
Jorge. Muchas gracias.
Bueno, pues yo les voy a platicar un poquito de nuestra experiencia que hemos tenido en Cushman con estos créditos de Safety First que salieron por el tema de la pandemia. En nuestro caso, hemos tenido la oportunidad de aplicarlo en 4 proyectos, el crédito Re-Enter Your Workspace, de los cuales 3 ya no los aprobaron, ya nos dieron los puntos en los créditos, y uno está pendiente porque no lo hemos mandado a revisión, pero esperemos que, pues, que todo salga bien. Como todos sabemos, el 90% del tiempo de las personas lo pasamos en interiores. El tema es que con todo esto de la pandemia nos dieron un giro de 360 grados, en el cual todo lo que estábamos acostumbrados a hacer, pues la verdad es que ya lo hacemos de una manera completamente diferente desde nuestras casas, o que estás en la junta y, por ejemplo, en mi caso, que estoy hablando y me empieza a ladrar mi perro, no sé si les ha pasado ese tipo de cosas como que son muy, muy de la pandemia. Por todos estos temas y también por económicos y muchos otros, realmente sí tenemos que aprender a vivir con el tema de la pandemia y todo esto y adaptarnos, porque pues eso es algo que tenemos que hacer sí o sí, pero también hay otra opción que realmente es lo que se le está tirando a nivel mundial, que es el regresar a las oficinas. Este crédito en específico se enfoca en eso, en el ver cómo poder hacer que podamos regresar a las oficinas, pero no sea nada más así porque sí, sino que esté pensado, esté diseñado, esté planeado para que los edificios estén preparados a recibir gente y no tengamos los riesgos de contagio. Este crédito está basado en 3 ejes. Los 3 los tienes que realizar para poder cumplir, y son realmente muy sencillos, están todos en la página de los créditos piloto del USDC. Lo primero que tienes que hacer es un Reoccupancy Assessment Tool. Esto es como un checklist que está realmente muy amigable, y te van diciendo si tu edificio es de tipo comercial o es residencial o un hotel o lo que sea. De ahí tú vas llenando si tienes espacios para poder hacer la sana distancia, o si tienes letreros en el baño para lavarte las manos, o si tienes estaciones de estos que te dan gel antibacterial. Todo ese tipo de estrategias, tú los vas llenando, y al final te da como una preevaluación de cómo está tu edificio en materia del COVID, de la preparación para el COVID. Una vez que tienes este assessment tool, te pasas al plan de manejo y operación del espacio. Este es el documento más importante porque es como tal una política, es un escrito enorme en el cual tú vas a decir, el proyecto que está intentando ser lead está persiguiendo estos créditos, y pones una descripción muy general, y luego vas a poner tal cual las estrategias que estamos implementando, que ahorita, al menos en México, por eso fue que lo aplicamos, ha sido muy sencillo, porque ya lo hacemos obligatorio. Todo esto de que te tomen la temperatura al entrar al espacio, los tapetes en la entrada, el gel, los marcadores de la distancia, nos dimos cuenta que era una oportunidad bárbara para conseguir este punto y realmente hacerlo algo importante para poder dar la seguridad a los ocupantes, porque en México ya se está haciendo. Como sabemos, la certificación es de Estados Unidos, entonces esto está muy enfocado a cómo viven allá. Y allá, pues la verdad es que tienen como las prácticas, pero no en todos los lados lo están haciendo forzoso. Como aquí, que para que puedas volver a operar, tienes que tenerlo esto. Lo único que hay que hacer es que todas esas estrategias hay que tenerlas escritas en un documento oficial. Y una vez que ya tenemos todo esto y lo aplicamos en sitio, hay que compartir unas bitácoras. Esta bitácora, tal cual, es un cuestionario que se le reparte a los usuarios, y va a decir, oye, pudiste hacer la sana distancia el día de hoy, cómo te sentiste, sabes cuáles son los síntomas del COVID, todas estas cosas que pueden sonar, entre comillas, mensas o muy obvias. La realidad es que es muy importante estarlo monitoreando diario, porque así vas sabiendo qué áreas de oportunidad tienes y qué puedes mejorar. Esos son los documentos que te pide el crédito. Aquí les puedo enseñar unos ejemplos de donde lo aplicamos. Si se fijan, esta sala de juntas, lo que estamos haciendo es, ok, si la necesitamos que esté completamente llena, no podemos poner como una silla sí, una no. Al centro la estamos dividiendo con mamparas, y a los costados también, para que cada persona esté en su propio espacio encapsulado, entre comillas. También en otras mesas lo que hicimos fue como, aquí se puede sentar, aquí no. Y vas poniendo las rutas de cómo vas a entrar a la oficina, los sentidos, cuántas personas pueden entrar por sala de juntas, todo ese tipo de detalles. Aquí también lo que tenemos es, tú llegas al mostrador y te van a atender, pero llega otra persona, entonces en vez de que esté ahí junto a ti, hay que separarla, hacer la sana distancia, y ponemos los marcadores para que cada persona se vaya alejando por lo menos el metro que se necesita. También tenemos salas de juntas que se cancelaron, que ya no se pueden usar, al menos hasta que la situación mejore. Ese tipo de detallitos que, como les decía, la verdad es que ya se aplican en México, solo que no están regulados en un documento escrito. Igual aquí tenemos los tapetes a las entradas, que no haya cruce de sentidos, entonces eso es un camino de entrada y un camino de salida. En este caso nos da la posibilidad porque pues, tenemos las dobles puertas, pero en otro proyecto lo que tuvimos que hacer fue hacer una puerta que sea la entrada y otra hasta el otro lado de la oficina que sea la salida para evitar los cruces. Igual estamos poniendo dónde te puedes sentar y dónde no. Si se fijan esto, en el de la derecha hay un marcador verde y hay un marcador rojo. El rojo es que no puedes, el verde es que sí. Y también en las estaciones de trabajo, en este caso lo que se hizo fue etiquetarlos como A y B, para que al momento de que se regrese la gente, digamos que se hace como de todos los colaboradores, se hace una lista y un porcentaje se manda a la opción A y otro a la opción B. Entonces los de la A van a ir los lunes y martes, y los de la B van los miércoles y jueves, y el viernes no van. Entonces así lo podemos ir como alternando de acuerdo a lo que el cliente se sienta como que a gusto, que esté de acuerdo, porque no necesariamente es que sean esos órdenes de días, pueden ser uno sí, uno no, o alternado, solo es que realmente no esté completamente lleno el espacio. Y por ejemplo, en este caso, aquí, este es el que aún no mandamos a revisión, pero ya lo están aplicando. Si se fijan, tenemos la salita de juntas, bueno, el booth más bien, que está cancelado. Este ya no se puede utilizar, era para reuniones como casuales. Y al fondo, del lado de la foto de la derecha, que está hacia la terraza, ese sí se puede usar, porque aparte de que está ventilado, está alejado de todo lo demás. Y tenemos los marcadores de la distancia y los sentidos y las mismas estrategias que ya se hacen. Y pues no sé si tengan alguna duda o si quieran platicar algo más a fondo.
Muchísimas gracias, Jorge. Si les parece bien, vamos a empezar entonces con la sesión de preguntas y respuestas. So I'm going to start with Kelly. I have some questions for you. Have you been talking much with federal or local government about the public health impacts of green building to promote policies or support?
That we have not been doing that as explicitly or intentionally as we should. Our advocacy lead at USGBC has certainly included the health piece into some of their efforts. You know, one of the things I've thought a lot about is within the U.S. Our advocacy team has been very successful at getting local incentives for green building already in place. And I think it might be a really good time, even as in the schools example I was giving, it's a great time if either local governments or organizations already have green building policies to come back with that second piece of communication to make sure it's understood how those green building policies relate to health and could be leveraged to very intentionally promote health at a time when we as a global society are more focused on health than we have been previously. So I have not done that myself. However, I know our advocacy team and then also our lead for cities and communities team there's a lot of different health components within that program as well.
Thank you, Kelly. Was it initially hard to get real estate interested in public health versus the immediate health of their employees or tenants?
Yes, it is. But I do think that that's where, again, actually having this be really rooted in green building from the start helps with that, because so many green building strategies have broader public health benefits from the environmental perspective. But yes, it's really funny now. It was always funny to us, but especially now, given the experience that the retail industry has had with COVID. A few years ago, when we were engaging stakeholders to inform development of the GRESB Health and Wellbeing module, we had a retail property fund manager who very much disagreed with the notion that they had influence on the health of the community around their retail assets, and on the flip side, that the health of the community around their retail assets have influence on them, which I found to be very funny. And I think we are, again, kind of entering a time in society in terms of and where private sector is going, that you don't necessarily need, that those conversations will be easier, that you're not going to really need to be making the case as much anymore, because it has been very clear how broader societal health influences business. And so then the next step is, well, making it very clear, how can you as a business take action? And for our purposes, making sure that real estate is seen as part of the way that businesses can act, I think is going to be really important.
Thank you, Kelly. Can you give us an example of random acts of health promotion?
Yeah, I think what that tagline picks up on is sometimes we can be tempted to take really generic cookie cutter approaches to health. And what I should specify is there are some baseline things that you should always be considering. Like air quality is one of those. Like that is something that regardless of the type of person you are, the type of job you're doing, we all need and benefit from clean air. But there are other things, if you're going to need to start making prioritizations of strategies because of budgetary restrictions or whatever it might be. One very clear example that our colleague Chris would use that I think demonstrates this really well is 5-10 years ago, once the active design guidelines came out, which are focused on promoting physical activity through the way that you design a building, they became really, it was an exciting new thing for people to be able to do. And it can be tempting to think, oh, well, that will be good. We should implement those everywhere, like regardless of the building type. When in reality, if you think about particular building types and the people that use them, think about a hospital, for instance, and nursing staff. They don't actually need any more physical activity. They actually need resting areas. The same would be true for industrial spaces. If people are working on factory lines, they also don't really need any more physical activity, but they need areas to rejuvenate. And so I think an example of a random act of health promotion would be just simply thinking that active design was good to use at all times, regardless of the population impacted, whereas taking a more intentional population context-specific approach that's driven by process allows you to just leave space within the project timeline to have those discussions to make sure that you're being intentional and thoughtful about how you're spending not only your time as a designer, but also the project's budget.
Thank you, Kelly. I have one last question for you. When can we expect the worksheets to start the health conversation with stakeholders?
Very soon. I would say within, definitely within the month and perhaps even within the next few weeks. And so is that something actually that it would be easy once we have it published, we can maybe share with this group via email?
Wonderful, and we could even help you translate it to Spanish, so we can have the Spanish version. So we'll be in touch with you.
Perfect.
Thank you, Kelly. Just one last question for you. Great presentation. I would love to have access to the presentation if that is possible. Thank you. I don't know if that's possible.
Yeah, I'm comfortable with sharing the slides, so we can definitely share those as well.
Okay. Thank you, Kelly. So I will switch to Spanish because the next questions are for Jorge. Thank you, Kelly.
Thanks.
Jorge, ¿en algún momento nuevamente puedes poner de nuevo los créditos o prerequisitos que pide LEED?
Sí, déjenme, les vuelvo a compartir mi pantalla. Listo. Para este crédito como tal, no hay prerequisito, o sea, este es opcional. Aquí lo único que tienes que hacer para poder aplicar es, bueno, como cualquier crédito piloto, hacer el registro del crédito piloto y la encuesta al final de que lo hiciste. Y dentro del crédito como tal, tienes que mandar estos 3 documentos. El Reoccupancy Assessment Tool, el cual está dentro de la biblioteca de créditos piloto del USGBC, dentro del Safety First, Reenter Your Workspace, que es ahí está. Y el plan de manejos es un escrito tal cual, punto por punto, lo que se está haciendo en el espacio, explicando con fotos y descripciones muy, muy puntuales de cada estrategia. Y al final la bitácora, bueno, en nuestro caso lo que hicimos fue una de estas encuestas de Google y se la mandamos a todos los ocupantes diario durante un periodo de unas 2 semanas para tener un índice de respuesta real.
Muchas,
Pero como tal, requisitos no hay, son solo estos cosas, bueno, esto es lo que necesitas para poder cumplir con el crédito.
muchas gracias, Jorge. La siguiente pregunta. Jorge, ¿cómo se ha expresado el público en general y sus clientes en relación a las medidas que están llevando a cabo los proyectos de Cushman?
La verdad es que hemos tenido una respuesta muy buena, porque, digo, todo esto del COVID es, de cierto modo, pues lo que está de moda, por así decirlo. Y la verdad es que como cuando les explicamos, mira, fíjate que para poder cumplir con este crédito y ser un punto más, hay que hacer estas estrategias que la gran mayoría tú ya las estás haciendo. Entonces hay como mucha aceptación porque realmente, uno, ya lo tienen y dos, te ayuda mucho a prevenir contagios. Entonces lo que ahorita buscamos es disminuir esa cantidad de contagios. Entonces la verdad es que ha sido una aceptación muy buena y nunca hemos tenido como un caso que nos diga, no, la verdad es que no lo quiero hacer o no me interesa. Todos están muy, muy emocionados y la verdad es que sí lo ven como una muy buena opción.
Muchas gracias, Jorge. Te preguntan, Jorge, ¿este crédito lo aplicaste en un edificio bajo esquema LEED O más M o es nueva construcción?
Lo hemos aplicado en 3 ID más C y un O más M. 3 de interiores y uno de operación.
Perfecto, Jorge, muchas gracias. Pues ya son todas las preguntas, entonces, pues nada más agradecer a todos los asistentes por su participación el día de hoy. Muchas gracias, Jorge. Thank you, Kelly, very much for a great presentation. Y bueno, pues nada más recordarles que apliquen su hora de educación continua para las personas que tengan credenciales LEED y pues es todo. Muchísimas gracias a todos por su asistencia el día de hoy. No sé, Rebe, si quieras agregar algo.
No, nada más, thank you so much, Kelly, for the time you took to be with us today. This was very enlightening for our market. And Jorge, muchas gracias de verdad también por platicarnos sobre sobre la experiencia de Cushman & Wakefield. Seguiremos llevando a cabo estos webinars. Este webinar se va a subir a la página de Zoom, a la página de YouTube, para que lo puedan volver a consultar, si este es su deseo, o lo compartan con quien ustedes piensen puede beneficiarse con este webinar. Agradecemos mucho su presencia el día de hoy y seguimos en contacto el mes que viene. Thank you so much, Kelly. Have a great day, you all.
Thank you very much.
Gracias a todos.